We heard back from the parallel session 12 different action items, or rather 11, because our first group focused on 2 of them. We also had a very rich discussion in the plenary sessions, and what I would like to do is very quickly report back on some of the key items that came back from there, and then I would like our 2 panelists to briefly reflect on what they thought about some of the items that were discussed here, or some of the action items put up there. And then I will have some leading questions for them. Celia has been taking very copious notes and has distilled them down to some main action and key items that emerged from the plenary discussions. I will give you the highlights from there, the bullet points from there. You will recall well, I hope, those discussions. The general point from our plenary session 1 on learning from global, regional, and national perspectives. Emphasis should be on nutritional advocacy. The 3 main bullet points that came out from there: political will is there, translate the will into action. Item number 1. Number 2, build on previous best practices and scale up. Number 3, make a common framework to integrate nutrition across the various ministries. Ministry of Agriculture, Irrigation, Water Development, Ministry of Health, and Celia, you have written DNHA, but I'm afraid I don't remember what that is, but you will know it in the audience. Number 4, invest in community level advocacy for nutrition. And number 5, private sector involvement should be increased. Those were the main highlights from yesterday's discussion. This morning, plenary session 2, evidence on agriculture's contribution to nutrition and health outcomes. General point, emphasis on making linkages. The bullet points: behavior change in nutrition, number 1. Number 2, who drives research into new varieties. Number 3, strengthen extension services. And number 4, scale up distribution. Don't stress on writing all of this down. We will share it with you. But I put it here as part of our conversation. And plenary session 3, strengthening the linkages. General point came out very vividly: make nutrition more visible in ASWAP. Bullet points: ASWAP emphasizes increased production in line with MDGs, but let's not confuse national food security with household food security and with nutrition security. Number 2, nutrition must be streamlined, mainstreamed, integrated at district level. And number 3, in searching for cross-sector linkages, let's not neglect the possibilities for integrating nutrition within the parts of the Ministry of Agriculture, Irrigation and Water Development. So Mr. Luhanga, Dr. Luhanga and Dr. Ferry, we had a very rich set of discussions in yesterday afternoon and this morning, and you heard also from the parallel. So I'd like to ask you first, any thoughts that come to your mind, any reflections, any comments that you wish to make on this very rich menu that you feel that you yourself took away as key messages or that you felt is missing? Anything you'd like to add or subtract to this very rich menu, or do you agree with us? Very rich cake here. Now let's find ways to bake it properly. Let me turn over. The mics should hopefully be working on your side. Do you want to begin, Felix, first?
Yeah. No problem, I can start. Okay. I think the summary actually has articulated critical areas, but I feel that there's one thing which is missing, or 2. I think we are supposed to have probably a statement where nutrition should adequately be integrated in the sectoral policies, for example, agriculture, and also ensuring that we have adequate capacities at district level to actually do the actual implementation. Because if we don't go beyond the national level and have clear work plans and budgets, then it may also jeopardize our implementation. So I thought that probably those 2 could also be highlighted and come out clearly.
Thank you very much. Jeff, would you like to come in?
Yep. I think, first of all, just to congratulate all of us. This is a lot of work done. I mean, normally workshops last for 1 week. This is 1.5 days. 1 day, in fact, opening ceremony and all that. That's a lot of mileage covered. Just want to congratulate. But I think as we reflect, I really want to see, not necessarily today, but maybe down the road, prioritization. This is a full house. And I want to let's remind each other, we're busy here. I mean, everybody's doing something every day, all the time. So many meetings. Question is, what is it that we want to do today? What is it that can wait that we want to do tomorrow? So there will be an element of sequencing, prioritization, sequencing, and then realizing that we should cut it a very small piece of cloth. If we open too wide, it will flop. I said yesterday that I wish this day would never come to an end. There's so much fire in a meeting like this one, but it fizzles off because all of us were going to another. Tomorrow there's a very big meeting on ASWAP, very big meeting in one of the hotels in town, a very big meeting, and another day of commitment, and I don't know, buying in, I mean, this is the real reality. So prioritization is one of them. Then what is so important to me is I wish somebody could come up who would be the driver. Yeah. I don't have an answer. I wish I would give an answer. Who is the driver? Not all of us can move this thing. It's not possible. Someone goes to Washington, someone goes to Israel, someone to Uganda, my other country, Yeah. Issue was, who will drive this program? Who are we going to hold accountable? Out of that, an effective MRD program. Yeah. I like to buy in Kaponda Mugaga's comment of grassroots participation. The answers are within, but we don't have time to do our research. So out of that, I really want us to invest in lessons learned. Yeah, that one should be, the first paragraph is the good practices where we have succeeded. And we should also recommend on part 2 where we failed. Why did we fail? Then now build to move forward. But to me, the most important is prioritization. What is the little that we can do to make a difference? Then maybe lastly, something which I really want to emphasize, the ASWAP is there. That framework, the governance issues, the executive committee of ASWAP, there's agriculture, there's Mere Shower, there's local government, there's finance, I don't know, you see, the economic planning. These are this is the supreme body for ASWAP in terms of vetting the program. Then the other committees follow. I still believe the specialists should dissect the ASWAP and see the effective entry points. Because if Mere Shower sits on the executive board of ASWAP, then sure, nutrition must be there as one of the element programming. I think Kaponda Mugaga is also part of that. Yeah. When you talk of the platform, ASWAP was a platform. Maybe you need to go in and look at the membership. It's a big national forum. I think that's what they're calling it. So someone must take time out and look at, what is it that can be mainstreamed in ASWAP. Most of the proposals are already there. What do we want to do? I think we all want to succeed, but the challenge is to find a way on how we're going to do it. But this process is the best way to begin.
Where would you want to see this process go further? How would you want to see it institutionalized?
I think what I would want to see from my own experience, I talked about substance and the like. I think if you talk about something, it goes up. Yeah, just talking about it, like HIV/AIDS. HIV/AIDS has taken hold because at first people could not talk about it. Oh no, it's a taboo, it's taboo. But when you open and start talking, you're already making progress. So you see all these posters here, the posters in town. That's the beginning. I just want to propose one thing. For this year, 30th October, we're going to be celebrating the Africa Day of Food and Nutrition Security. That day is an AU day, but it's our government which proposed to AU, our president. Why not declare a nutrition week as part of a celebration of this? Because, today, there are people walking in town about Tourism Day. I've seen people marching Tourism Day. Tourism, yeah. And, everybody is looking. There's a track where they're going to Tourism Day. It's moving from Capitol Hill all over. Yeah, tourism. Now, unless you talk about, look about Coca-Cola. They started advertising in 1940. They're still selling Coca-Cola. It is there. It's the real thing. What is the real thing? This is what they drink, It's the real thing. Now, I always want to challenge a meeting like this one. Which is the most difficult thing to sell, to make money from? Which is the most difficult thing to sell, and which all of us can make money from? But it's very difficult to sell. But it is selling.
What's the answer?
The bottle. I can get water from my house and keep it in my bag. But I will not be Ruhanga. I must have it already bottled, then I buy it. I feel good to have this. Someone convinced me that I need a bottled water, but this water is tap water. There's no sugar added here. But I cannot pack it, put it in my bag to save money, school fees for my daughter. No. Then people will be laughing at me. What have you done? You carry your own bottle. The workshop will give you, If someone could convince us in this country where water is cheap and we're buying it, then nutrition can sell.
And we come to you, Felix. Can nutrition sell? And
if I want to spend money, how much is this bottle? It's more expensive than a bottle of Coca-Cola. This one is more expensive than a Coca-Cola bottle. Yeah. Now, if anyone can sell this bottle, can you imagine? You can sell nutrition knowledge. Nutrition. You can. Just learn how did they sell this water.
Well, let me hear from Felix. That somehow, why is nutrition not selling as well as it should? And what would you want to do differently? What would you want others to do differently from this conference? How would you want to move forward?
Yeah, I think we have tried to sell nutrition to some extent. But probably it's now translating what we are agreeing, what we have put in the policies and the other strategy into actions, so that it can reach the communities. For example, I cited an example of what week, the Tourism Day. There are, of course, the marching in town. But now when we are talking of nutrition, we should go into the community, not town. So I think, to me, we should now move away from the national, but let's focus now at the district and community level where we can make a difference. I think that's the way I feel that nutrition would make a difference. Because we have done a lot of noise at national level, we have made a lot of advocacy at national level, but at community level, as he has rightly cited the issue of Coca-Cola, have we managed to sell nutrition at that level as we have done with Coca-Cola? So I think that's the approach we should now try to go in, to make sure that it has reached the rural masses. Yeah.
Are we capable of doing that? Do we need to retool ourselves? Do we need to rethink the way in which we are organized? Do we need...
Yes, we do. We need to do that. Because right now, I think for us to manage in doing that, to ensure that we have gone into the community, we need to look at the capacities at district level, the coordination at the district level, since we have several players at that level. So how do we put nutrition on board at that level? How do we make them responsible and own nutrition at community level, district level? I think that's the kind of thing we need to do. Mm-hmm. Because at national level, it's already clear who own it. Mm-hmm. But if you go to the district, there are lots of issues there. So I think we need to move now into that direction, make the districts own it, make the coordination work at that level, as well as at community level.
So Luhanga, do you want to come in here? And you made the point about cutting the cloth. And any thoughts on where you'd want to cut the cloth? Maybe the bottom left-hand corner, or no? But it's a very serious point.
No,
where is the potential to? I agree with you. And you had to look, see, where would you want to cut the cloth?
I don't want to be prescriptive for a very simple reason. I think Kamuna Mukaga talked about grassroots participation. what is it that the people want. Dr. Daud is in the room here and a few others in the research department. Minister of Agriculture spent 4 years forcing farmers to buy hybrid maize, MH12. Farmers never bought it. High yielding. They didn't, they refused. They refused, and everybody says, do you wish yourself well? This is high yielding. They refused. As soon as we got a variety where they wanted a MH18, a flint variety, which is poundable, they still want it even today, even when the government wants to withdraw it, they still want it. So grassroots participation, what is it that they want? There was a lot of effort made in this country to withdraw these community-based midwives. What are they called? TBAs. Yeah. I was born in the bush. But at one point they said, no, this is not good. Today, government has gone back. These are accredited midwives in the community, and they are very intelligent. So, I don't want to sit here and then say this is what should happen. I beg to, I withdraw, I disqualify myself. Consultation should continue. But please, be all inclusive. Somebody said you want short-term solutions to meet project goals. In nutrition, you are investing to fail. You are going in for overhaul. I think that's Kalimbila. That's what you said, Kalimbila. It's a long overhaul. That's what he said yesterday. Who is willing to stay in another 10 years? We all want to move in and go away quickly to another program. We are in a hurry. All of us in a hurry here. We live for the day. That's why, you get, it's all cyclic. So, I don't know to prescribe. But I want to share experience here. Where do you start to provide knowledge? I think you start in this room. Unless people in this room are convinced, I know my friend talks of the districts. Forget about the districts. Forget about districts. They will not move anybody. It's not possible because it's about what is in fashion. The extension workers are all in this room. Everybody in this room buys a bag of fertilizer for their cousin in extended family. So, you agree with me, you may buy a wrong type of fertilizer for the village. Everybody goes home with a bag of fertilizer to give to the cousins. So unless you provide knowledge to people in this room, the village is gone. Because the money is in this room to support the people in the village. So transformation should happen starting with this community here. Are you going to eat indigenous vegetables? No, I want to eat cabbage because that's in fashion. It's just water there.
That's very interesting.
It's just water.
You have very different. Felix sees transformation, if I hear correctly, at the district level.
Yes. No. He talks about institutionalization, but I think the triggers is in this room. If people in this room are convinced, because I'm asking, who is the driver? The driver is somewhere here. Someone somewhere will be the driver. If we cannot convince this room, nothing works.
But is the environment conducive for a driver to flourish, or will the driver be cut down?
Sorry?
Yeah. Well, is the environment conducive for a driver? Is the environment such that there will be interest in letting a driver come and push this? And do you see a driver in government, or would you see a driver more in private sector pushing this in this new environment?
No. I
or
think,
NGO?
When I'm talking about a driver, I'm not talking of one person, but a critical mass of individuals that can have the passion to move this program. I mean, look, I gave an example of the Sept program last year. I think, Dr. Daud, you are part of this, and my colleagues in the ministry, program managers, you are here, Madam Karinde. You talk, you dream, you think, subsidy. It works. They're all in this room, the guys who make it move, they're here. And in fact, we're delaying them. They need to do some of the work.
Yeah. Let me ask the co-organizers.
Excuse me.
Yeah.
The people who drive the subsidy program, they're in this room. They don't sleep. But they don't get an extra pay. They're here.
But the drivers are tied up. Let me ask my co-organizer of this conference, Irish Aid. Ruth, do you want to come in and ask any question or make a comment to our two panelists? And I also see Violet over there if you'd like to come in. Do we have a microphone? If not, just speak loudly and come over. I'd like to give our two co-organizers a chance also to participate in this. Thank you. I see Ruth's kind of rustling away, so. And then I'll come to you, Violet. Yeah.
Okay, thank you very much. I actually would like to maybe put this into perspective, because I think the workshop here, the conference here, is about agriculture, nutrition, and health linkages. But if you follow the discussion that we're having now, we are talking about selling nutrition. Okay? I think if we were to focus on what is being done to sell nutrition, there's a lot. Talking about what was just mentioned now, about the engagement of the grassroots. My colleague here, Felix, probably did not mention it, but we have, there's actually a national effort, which is a multi-sectoral effort, to develop a nutrition education and communication strategy that also includes nutrition advocacy materials. This has been developed as part of the Scaling Up Nutrition movement. In fact, everybody in this room is talking about scaling up nutrition now. It's because of the advocacy that was done as part of that, the posters that you're seeing. So what I'm trying to say is that in terms of advocacy for nutrition, IEC, trying to reach out the masses, there's a process that is in place. If we are talking of linkages between agriculture, nutrition, and health, we should make a decision whether we want to build on this or whether we are talking of a separate process. That is, do that. So that's my first point. My second point, I very much agree with the issue of having drivers. But I think maybe we need to be coming up with some very concrete agreement here or actions. Because I think this one, we're trying to make agriculture more responsive to health and nutrition. So I think we should try to see within the agriculture sector what kind of internal structural changes can take place so that the sector is more responsive to nutrition. Because what's happening now, when we engage agriculture and nutrition, we are engaging individuals, not the sector as a whole. So how does the whole sector become engaged? And I think just my last point is that in terms of being more responsible to the grassroots, I don't know if we have ever considered, we started off by the assumption that there are poor linkages between agriculture, nutrition, and health. But I don't know whether maybe we also want to understand the situation better. Maybe we need to do more analysis to really understand what are the linkages, what are the challenges, and what are the gaps, and how can we better respond.
Thank you. I'd like to ask Violet, if she as a co-organizer also want to make a comment or statement, and then I come to the two of you for the responses and final remarks.
I just want to add one thing. You asked both panelists on how we should move forward from here. Felix talked about capacity at the district and community levels, and I can't agree with him more. I think we do need the capacity. We simply don't have the people to implement nutrition at the district and community level. But I also agree with what Dr. Ruhanga said. I think the drivers are in this room, and we need to, I think what he said reminds me about partnerships. Yes, we have the institutional arrangements. Agriculture alone will not be able to implement nutrition. Health alone will not be able to implement nutrition. We all need to be involved. We have in this room NGOs, we have the academia, we heard from the private sector in the morning. Yes, all the drivers are in this room, and I think that's how we need to move forward. Let's not be suspicious. As government, sometimes maybe we are a bit suspicious of the private sector. Let's not be possessive of what we are doing. Let's open up, and I think that's how we can move nutrition forward. There are lots of NGOs. Dr. Karimbira talked about the MICA program. It was implemented by NGOs. There was a presentation from Ekwendeni showing some good practices. Those are partnerships that we need to build on to move forward. Thank you.
Thank you both, Ruth and Violet. Let me come back to the two of you if you'd like to respond to them and make any sort of final remarks and focusing on the way forward Where would you like, Felix, do you want to come first, or Jeff? Take your pick.
I think I've lightly said it, that in as much as we want to move this, the issue of capacity should be addressed if we have to move, because almost in most of the meetings, this is clearly coming out, issues of coordination. So I think these are the areas that we need to focus. Ruth has mentioned about the nutrition, education, and communication strategy. Yes, we are developing this. We are doing all this, but who is going now to deliver this at that level? Those are the issues, because we may have very good plans, we may have very good strategies, but now putting them into actions, that's where we need to focus. Yeah? The issues, for example, the MICA project, which has been pointed out on several meetings, for us to achieve that, we need to work together. We need to have people who can implement that, including the NGOs and other key players. So I think the issue which you could also emphasize more is the coordination and partnerships. We need to strengthen this, because government alone cannot achieve. We need the partnership, we need to work together. And also, when we have best practices, the government should take an initiative to scale up those best practices, rather than just bringing them in meetings, then it ends there. But we should also look at scaling them up and use the lessons learned to work on nutrition. I think that's what I would say.
Thank you very much. Dr. Lahanga?
Yeah, I think maybe to accept in this room that we build this house brick by brick. If we do that, we're going to do something. No one should think to go big, mega. It will never, this thing will crash on us. For anybody who wants to get started, Lilongwe provides an opportunity. We're all here. Why can't we transform just one village? There are more villages, Minister of Agriculture. Madam Director, you're here, isn't it? Yes, the Director of Extension is here. Let's go to one village and just see what works in the village. Let's adopt a village. Each one of us will build this brick by brick. I have a problem. If someone wants to say, they want to go all over the country, it's not possible. You crash. You're going to crash. If we don't have resources, let's transform it the wrong way. It becomes our lab. And that's where the money goes. Then that's a nuclear. We spread out. By God, let's talk of not of Karonga when we have not done anything the wrong way. Let's not go to Sanji. When there's a village next to us, that is, that is in pain in terms of information. So, I want to challenge this meeting. You will form a working group. Very dedicated individuals. They should be locked in a room for 3 days. They should come out. That's how science was born. They should give us the solutions. Money can't be an issue. NGOs are there, they should hire immediately. Kaponda Mgaga hired a nutrition officer within 2 months. Others wait for 6 months. These are lessons in this room which I'm just quoting. I was only made aware of this yesterday. Somebody made a decision, I'm going to do something. But somebody wants to have a plan and revise the plan. Then stakeholder workshop. Then define the plan. If Ministry of Agriculture were working like this, the sub-step program would have taken 3 years to implement. There was no roadmap. My colleagues in this room, PM Blunt ADD, was there a roadmap for the sub-step program? And everybody said it was going to crash. They said, no, you don't have a clear roadmap. So how are you going to do it? How about monitor and evaluate? Said, no, we will not monitor and evaluate if there's no work done. Let's do first, then you're going to monitor. Then there are so many now studies on the subsidy program, Review, Malawi success story. No! Somebody must go in and just make a lot of mistakes. Cleanliness is for researchers. Real world is market. I challenge it's good for the papers. But development is not good for the papers because you just mess up things. Then you organize and break. Why am I saying this? I get frustrated for people who want to plan and test the theory, then review, then perfect. I'm part of that system because I'm a researcher. It is the best way to do things. Some people must be disciplined. But I think for developers, they should not be disciplined. The two should live side by side. Yeah, they reinforce each other. But this meeting should not be about having a perfect plan. Let's start with Lilongwe tomorrow. Natenje. Chiteze. Thank you.
I'd like to thank both our panelists. They reminded us the drivers are in the room and we are not going to look at each other, we look at ourselves and consider ourselves the drivers. They've also challenged us, let's get moving. I remember Alexander from yesterday, let's get moving. I remember Todd from yesterday, pressing problem versus optional problem. You're saying it's not an optional problem, it's a pressing problem. Find solutions.